Hi, good morning. Could you please confirm is it ready for the class? Yeah, great. I got a message. Hi, good morning, everyone. Hi, good morning, everyone. Is my voice clear? How's it doing? So, is my voice clear to you or not? You can hear my voice? Yes. So, whenever there is any doubt or anything during the class time, you can just raise the hands or don't or anyone can raise the hands at the end point of the discussion time. You can discuss it with me. Okay. So I just wanted to know before I'm just introducing myself. I just want to know about yourself. So could someone give me a brief introduction about your college and about your current year and about your requirement? Yeah, yeah, that's great actually. I'm also having a personal connection with Dr. Chris. That's what I'm here right now to take a class with you. And this is like, I don't want to be like a teacher student class actually. The things needs to be delivered from my side, but it's mostly a discussion session. And I'm just looking forward to get a great input from you. Okay. So, shall we start? Shall we start? It's so to everyone, my voice is clear, right? Those who are the backbenchers, my voice is clear or no? For the backbenchers, it's because I always used to be sitting the backbench. Actually, that's what. Yeah, everyone. Okay, great. So we can just let's start our class right now. I'm just gonna to be share my screen. Maybe it's few minutes. You can see my screen right now, right? Hello. You can see my screen, right? Yes, yes. So, based on your college, actually, they gave me the content for today's session is nursing information system and healthcare data for effective healthcare management. So, while hearing this one, maybe you will feel bored, and it's not an anatomy and it's not a physiology, it's not a psychology, it's not related to any nursing procedures, it's related to an entirely different field. So maybe I feel actually this is your first time, or when you are in the clinical you already met many of them, those who are using information system or healthcare data for the effective or quality patient care. Am I right or wrong? You start your clinicals, right? Yeah. Then how in your hospital they are documenting it by using manual or electronic? Is it through manual or electronic? The documentation system in your hospital is manual or electronic? Pardon? Yeah, both manual and electronic. This is what I heard from you. But anyhow, this is a new it's a new emerging area for us the nurses. to be stay in the future too. So just listen, and if there is any difficulty to follow my instructions or my voice, just you can ask me again and again. So my main objective of this class is whenever you get a question related to nursing information system and healthcare data for effective healthcare management, you you should able to write a two-page essay. This is a very brief thing that's what I need for writing that one. I don't want it to you to by heart one, two, three. You have to understand what exactly that is. So here about myself. Currently, I'm working in nursing administration, informatic nurse. I'm right now working in United Arab Emirates in a multi-speciality hospital as an informatician. So that's my profile. Again, when you are thinking, in my profile I wrote I'm an informatician or informatic nurse or nursing informatics. Did you hear about this term before? Did you ever hear about this term before? Group. I know there is some difficulties to communicate with me, but still, somebody can speak up. Did you hear anything about nursing informatics opportunity for a nurse? Did you ever listen that, or did you ever read about that? Group, are you listening? Right? So, nursing informatics. This is a specialty that always integrate nursing science with the nursing or multiple informations analytical science to identify and to define and to manage and communicate data, information, knowledge, and wisdom in nursing practice. This is a very brief definition about nursing informatics. This is a very vast area where we are connecting. Actually now everywhere the technology is what we are sitting like this actually from one country to other country. I'm communicating with you through the technology just because of that. So in, in the nursing care or nursing practice or evidence-based nursing also the technology emerged. So because of that reason our field also is getting grown up with many specialized areas, and this is the one of the specialized area. So as a nursing students, now in your mind maybe you have a thought how I can be a nurse informatician in the future. You need to get an experience in the nursing field, nursing task, and you are having a many specialized courses and many specialized exams to pass for that actually. And this is what actually you can look at it in the future. For many people, a nurse informatician and healthcare informatics in general about technology. But no, it's not only a technology. This is especially true of electronic health record that record all care facilities. This is just one among many aspects of nursing informatics. What in very short, as a nurse informatician, we are looking not only in the late term, actually, not only in the documentation that we are doing electronically. We are having a many area that we need to be look on to 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 compare the data, to analyze the data, to analyze the information, or to identify the work path of full hospital to provide a better quality of care to the patient. So we will go to our content today. So our overview of the presentation. Today, what we are going to discuss is nursing information system, that an introduction. And what all are the functions of nursing information system, use of healthcare data in the management of healthcare organization, using the information in healthcare management, components of nursing information system, evaluation, analysis and presentation of health data to inform decisions in the management of healthcare organization, and finally we will conclude on that. So we will go through our topic right now. This is what we are going to cover. While hearing these headings, maybe you will feel much burden or overwhelmed. No need to be get overwhelmed. Just we will go it as simple as possible. So what the nursing information system means, or how, what it exactly what the information system. See, the nursing, what we know, what we already knows that what is nursing, right? So information. Information means what exactly the information means. There is some knowledge or some data that related to nursing, that we can say like that. And again, a system. System means there is a proper channel that helps to get identify this information related to nursing. This is what actually we are getting it from the heading. So what we are going to identify right now is nursing information system. So keep it in your mind, nursing information system. So this nursing information system, any informations, any this is like a software. This is like a software that plays a very crucial role in our healthcare industry, that means in our hospital, to provide a structured approach or to provide a systematic approach and organize the patient data and information. This is very simple. So what exactly the nursing information system means, it's a system or it's a software that help our hospital to provide a structured or a systematic way to organize or to organize the patient data and information. I hope it's very clear now. Again, this is where it's useful. So we can say that this tool or this software is very valuable tool to whom? For nurses and also for any healthcare professionals. For what? To deliver what is our ultimate objective, or what is our ultimate goal? To deliver a efficient or a productive or a high quality patient care. So once when you got a question or once you think about the nursing information system, again we need to think what all are the components, or what the system contains, or what all are the content that are covering in this system. That includes where it will be focused, and or various components and functions that streamline clinical workflows. So how it helps? So to organize systematically the clinical workflows, or to help or to support any decision making, and also this helps to communicate, or this helps for the communication between healthcare workers in healthcare setting. This is what you have to understand. You don't want to buy hard anything. You just listen me careful. You can get an idea what nursing information system means. So you can say it's a system, and again you can say this plays a very crucial role in hospitals or in healthcare industry. For what? To provide a structured approach to manage and to organize the patient data and information. To whom it's helpful? This is mutually or systematically. This tool helps in providing a high quality patient care for nurses and also for healthcare professionals. Again, these components, the nursing information system components, that streamlines our clinical workflows. What clinical workflows? That means we can say the patient journey. You just think about, for example, the clinical workflows. We all are going to the hospital. What we will do first? We will do the registration, or we will book our appointment early and we will go on that time, or directly we will go walk in and we will take an appointment. Then we will wait over there, and the triage unit or the nurse in the assessment room will call us for the assessment. Then we will wait, and then the doctor or the one who needs to consult will call us. Then we will go and consult him or her, and then we will proceed. If we need to go for the pharmacy, then we will go to the pharmacy, or whatever, the step by step. Everywhere, even in the emergency, or even in the OPD, or even in IP patients, there is a workflow. Each and everything, it will go like in a workflow. So this nursing information system, that streamline, that we can, if there is any issues in the workflow, or many patients are complaining, I'm getting a lot of waiting time after assessment to see a doctor, or the patient is complaining about lot of waiting time in the queue to register my name in the system. So these all are the examples for a workflow issues. So these workflows can be modified, or this will be modified by using the nursing information system. So you will think how? When we are entering the data, we are capturing the time and data analysis. We are doing that data analysis. And from that data analysis, we will conclude how long the patients are waiting. This is, for example, how long the patients are waiting after assessment, or how long this patient took for an assessment in nurse assessment room. Then what we will do? Then we will do an data analysis, and we will find out what exactly the cause is, Then we will compare it with the workflows, and again, we will plan some actions. Then we will again reanalyze the data to improve the workflow. So these all are in detail. So this is what about nursing information system. So I already explained you what is nursing information system. So what all are the main functions? This is what actually specifically in your syllabus that asks you to learn. So I'm just focusing on that way. So you can just prepare your notes based on that actually. What all are the main functions of nursing information system? As I told you, the care planning. Again, once we are entering the informations properly in a systematic way to the system that help us to plan our care properly, that help us to coordinate or that help us to monitor the patient outcome. This is what all the technology about. With a one screen, we can identify and we can visualize how the progress is going. Again, what's the main function? Nursing clinical records. So, in the nursing information system, if you are going for the technology, the patient assessment, interventions, outcome, or informed decision making, everything is so comprehensive. So the nursing information system make everything comprehensive and accurate nursing clinical records can be maintained. We can just minimize the human errors. By using the technology, we can avoid a duplication. That's one of the good part while using the information system. We can avoid a duplication. So once we are using the system, for example, if there is a duplication in the order, the system will alert you. Or when we are doing the patient, when for an example, if you want to give a medication to the patient, so for example, but you are not asking or you are not asking about the patient related to the allergy. So you miss that communication. But what the technology, what the system will say, once you check the order, you will get an alert or you can get a pop-up message like the patient is allergic with this medication or this classification of medication. So this help to provide a good quality of care to the patient. Again, the care evaluation. And the other, we discuss about one aspect, it's like a planning or providing the care to the patient. Then we discuss about the documentation part. Then we will discuss about now the evaluation, care evaluation. Evaluation of care delivery and patient response that can be identified. So when the technology comes up, that we can retrieve the data to identify or to evaluate the care that we delivered. For example, after the discharge, we can just go through the file and we can analyze the file, or we can just analyze the file. Did she missed or he missed any part in the care? Or once the patient raised a complaint, or the patient raised any kind of complaints against the healthcare person, we can just go with a root cause analysis in a systematic way. And this is a data that we entered, and there is no duplication. And also, once, and the manipulation is also very less in this. We cannot manipulate, we cannot change. Once we signed, that's signed. Or once you try to modify the data, that's modified. So this is we with a proper navigation through the system, we can we can evaluate how the quality of care delivered to the patient or in the system or whatever actually. So in short, the nursing information system, what it can be useful, what all are the main functions? It can track the data, recording and tracking the patient data. Again, this can give us a real time patient information to the healthcare providers. Once we are doing it in the manual, we are writing up the times. But once it's going for the system is popping up the time that what the time the doctors or the healthcare person ordered. What time I need to give them. For example, I have to give a medication at 9 o'clock. But okay, I can write it as like a 09. I gave the medicines. Even sometimes we just got delay. But in the technology, in the system, you cannot modify. Once there is an order at 9 o'clock, you have to give within a time frame. If you are not giving that time frame, this time frame is based on the this time frame that we are what we are giving that based on the policy of health institutions or in the hospital. If that medicine is not given in the time frame, we have to justify that. We have to justify that for what reason this medicine got delayed. Or if you are trying to manipulate the data to enter that and signed as 9 o'clock the medicine which I given, but if but this medicine that's given at 10 o'clock, the system will not wait for you. The system runs the time. System is going based on the real time. So once you signed, even at 9 o'clock, the information that from the system will capture that you entered that information wrongly. The actual time that you gave that medicine is at 9. This is what uh, some good or positive aspect about our information system. Again, I told you about the clinical decision making. So how we can take a clinical decision making? Okay, for example, if there is an information system that we can identify what was the complaints rate for our nurses, those who are doing a proper hand washing. This is an example. So when we are monitoring that one, we will just get a monthly complaints rate. So this is a data that we are getting from the system, and that help us to do the clinical decision making. I already mentioned about improving the patient safety and quality of care. So again, I gave you an example related to a workflow and supporting the nursing documentation. So these are the very brief functions that the nursing information system help us. This is a very vast topic, and that we can just take like more than a day about all those topics. But as you are going with the basic of nursing information system, you can just focus on these points. Is there any doubts related to nursing information system? Any doubts from the group? Are you guys listening? Is there any doubt? Okay. I hope up to this time it's fine. So we will go ahead. Anyone is sleeping right now? Do anyone feel sleepy? Or is it interesting? Is it interesting? So how about your clinical posting is going? How long you are doing the clinicals? I I think how the system is working actually. This is an LED for all of you, or you are doing your own computers or laptops? How? Because I can see a group picture. I feel. Hi group. How it's working actually? It's in the group. It's a classroom LCA, right? Okay. Is it able to visualize and can hear the voice from the backside also? So who raised the hand actually? Could you please mention your name? Could you please mention your name? Come in front. Come in front. Come on, yeah, come in front. Yeah, come in front. Let me let. Come on, the one who raised the hand. Hope there is some teachers over there in the class, or no one is there. Come on, yeah. I just wanted to chat with you for 5 minutes. Why you are just feeling like? I just wanted to chat with you. So this is how we need to learn. I'm just seeing only a one student there. Always, I'm just getting a voice from the one student. Okay. So nobody can. I don't know the facility how it's. Yeah, come on. Yeah. Come. That's great. A good name. You can. What's your good name? Ravan. Tell me about two sentence related to nursing information system. What you got from my lecture? What you got from my lecture today? What exactly it's? I don't want any sentence from the book or my slides. What you got? In a simple way, in a very simple way, you can just tell me what you got. Raman, यार क्वेश्चन क्लियर नहीं है but I'm not good in Hindi. Uh, what exactly nursing information system means? What idea you got? You can just tell in a very simple way. Huh? Yeah. Pardon? Yeah, that's great actually. And it's mostly now we just you go and sit over there, man. Okay, that's really true actually. That's an information system that's related to nursing. So we can just divide the nursing information system into three. Nursing information system. System means there is a system. And what we are getting, that's the information. For what we are getting the information? To clear the pathway to provide a high quality of patient care. And mainly nursing information system is a software, or it's a system that they are focusing on nursing to improve the workflow or improve the nursing care or to improve the practice. Okay, so we will just go ahead actually again. We will go back to our topic. The next one is the healthcare data in management of healthcare organization. Healthcare data in the management of healthcare organization. We discussed already about nursing information system. Now we are looking on healthcare data in the management of healthcare organization. What exactly the data means and how we are using that data in an organization. So, when we are just thinking in a very big perspectives or in a very vast way, this data plays a very important role in hospital or in organization. So you mean basically once the patient enter and left from the hospital, in organization perspective, to deliver a healthcare or to monitor or to finalize any decisions, even for the financial charges, or even to check how this organization is running, data is important. This is what how healthcare data works. So this is we are thinking in another perspective about data. Like we need a count. For an example, this is a month of May. How many patients came to an organization in the month of April? So, how many patients came in that specific organization in the month of Jan? So, very simple. When you got 2,000 patients in the month of Jan and you got 1,500 patients in the month of April, so we got a loss of 500 patients in that. So we need to think why we got a 500 patient less. You got my point? Yeah. This is what how the data works. So again, that create an insight to the health leaders. And also we will identify if is it just because of any operational inefficiency, or is it just because of any lack of resources? So these data are always helpful for the administrators to identify what exactly the organization needs, because the graph needs to go higher. When the time grows, the name and the graph of the organization always looking forward to go ahead. But once it goes down, we have to think. So this is a call for healthcare leaders to identify and to enhance the patient outcome. Again, from the patient records and clinical data. So, what the healthcare data, once we are going for in private hospitals, every procedures we needs to pay. This is what how the private organization is running. So this how they are getting or how they are putting a patient for the payment from the clinical data. For an example, the patient is in a ventilator. So there is a ventilator charge. For every private hospital, there is a charge in the ventilator. So this is how the system will give you a data that the patient is in a ventilator. So this is the first day of ventilator. The system will give you a data. Once we extract the data, or once we look on the patient file at the time of the discharge, or in between, we can see what all are the resources they utilize and how much the charge or how much the financially how much it's charged. This is from the clinical data. Again, not only the clinical, not only for the financial thing, for identify the manpower. This healthcare data. There is a 500-bed hospital, and the nurses number is only 250, and we are getting a less outcome. So, based on the data that we are identifying, how many nurses we need in a specific unit. So how we are tracing the data? We will extract the data. For an example, from the emergency, we will extract a month data. Then we will see how many patients came, how many patients see, and their length of stay, how long they stayed in an emergency, how many of them admitted in inpatient, how many of them transferred from the department, or how many of them got discharged. Based on that data, we will identify the manpower. Utilize this information. So, how it will help? It will help, or it will helps to improve the workflow, or we can streamline, or we can modify the workflow, or we can allocate more staff or more resources. Using the information in healthcare management. Effective healthcare management. How we can use the information in healthcare management. That by using, as I told you already, this is like by using the metrics or financial records or patient outcome or workflow analysis. This is what I already explained. By analyzing the information, who can take the decision? The healthcare leaders can take the decision. For what? To provide more resource or to improve the efficiency, to enhance the quality. Data driven insights, that means whatever the data that extracted, that help us to improve these resources. Again, how we are using the information in healthcare management, that critical data that we are extracting. For example, we are getting many what I can say hospital acute infections. So how we are how we will improve that one. So based on an evidence, why or how many or when or where. We will ask. So we will extract the data. Then we will identify what the exact reason. These all can be done by using the healthcare management. This is what how the beauty is. Okay, before we discuss how we can use this information in hospital. Now we will discuss how it's helpful in decision making. The decision, how it can be helpful in decision making, that means data driven insight. This is a very big term. You can say the extracted data. Extracted data, we can just simply say the extracted data. When we got a data that help us to provide resources that will help patient outcome. With that data, we can improvise our evidence-based practice or decisions, or we can inform or we can communicate to the other healthcare management. Again, for the decision making, this can be useful in prediction. What it really means that we are getting the data. So this month, I got 1,000 patients in my hospital. Next month or the coming month, I can predict I can get 1,000 or more. Or if it's less than 1,000, that data will help us to identify what's the reason. This is what actually that paragraph is saying. We can identify the trend. We can identify the risk factors. Or we can anticipate the healthcare needs. We can anticipate how more resource that we need, how we need to be proactive, and that also that help us to make a strategic decision making. Maybe the strategic decision making is a very heavy term for you. That means the strategic plan in every organization or in your college or any institutions, we set some goal that needs to be achieved from the initial time, and we are working towards. So maybe in your college, maybe they put a strategic goal like uh, they needs to give an excellence in nursing practice. This is not yours, for an example. So what the nursing college administration is working with that goal to attain that goal. So like that, every area or every institutions or every organization, they have a strategic plan or strategic goal. To attain that goal, this can be helpful. Again, a collaborative discussions. So from one hospital to other hospitals, when we need a benchmark or collaborate with one or other hospital, we can make a diagrams, and we can show it to them. This is what our hospital is. So we are getting 1,000 patients. We are having this much specialty. We are having we are maintaining a 100% or above 95% complaints rate in hand hygiene, in patient communication, patient handoff communication. This is what how we can present it. And again, for the continuous improvement. So this is what the point needs to be discussed in the decision making. data-driven insight, and for the predictive analysis and collaborative discussions, continuous improvement. So now we will move on to the components of nursing information system. I told you actually the nursing informatics or nursing information system. It's not only an electronic health record system. This is only a part. So what all are the other components? So I hope you can understand what is electronic health record. That means it's a digital platform that we need to record all the documents. That why it needs to be to reduce the manual error, duplications, and also to focus on real-time access to the data. So workflow management. So I told you already, if there is any workflow issues or any any workflow issues or any delays or anything, or to optimize the care or to identify the problems or to utilize the time effectively, that we can use this information system. So in our system, I'm just giving you an example. In our system, that we can see at the end of the duty, we can see how many nurses. For an example, there is two nurses in an OPD for cardiology. So in the end, we can see that once we are just going for the data, we can see in the dashboard these two nurses, how many patients seen by these two nurses. Individually, how many patients seen, how long this nurse took time for the assessment, and if there is any delay, we can identify. If one nurse seen 100 patients and other patient seen only 10 patients, that's questionable. So we needs to be we needs to identify why. Or one nurse is taking more than 5 minutes for the assessment, and the patient's delay is more. So as an administrator, what we will go, we will analyze it and we will identify if there is any need to improve the competency of that particular nurse, we will give training. This is how the system works. This is how the decisions are taken. So this is what I already explained in clinical decision support. This is how the data that we utilize for decision making. And analytics and reporting. The purpose I already, this can able to visualize the trend, the performance, and inform the strategic healthcare management. The last part of our presentation, evaluation, analysis, and presentation. What evaluation means? How we are evaluating the data, how we are analyzing, and how we are presenting the healthcare data to inform decisions in the management of healthcare organization. This is how the heading that gives you in the syllabus. So we need to think evaluation, analysis, and presentation. How we can evaluate, analyze, and present the healthcare data in healthcare organization. So first we will think about data analysis and interpretation. How we can analyze the data and how we can interpret the data. We can do the descriptive analytics. When we are going for that analysis, we will just get out a summary and we can organize the data and we can reveal When we are doing the analysis, that's a very specialized area where we will do the analysis on that. And when we will identify the trends, patterns, and key performance. Once we identify there is some problems that existing and needs to improve, we will put it in KPI. That means the key performance indicators. I don't know what whether we are whether your hospital is following this key performance indicator, but somehow some hospitals are performing. And I already informed how the interpretation we can predict how it needs to be in the future. Again, the other one is data visualization. Once we got the data, we can make it as in a very simple way in the dashboards or like in the graphs, and we can present it into the organizations that this is how our data shows. And this data that we can do a benchmarking. Benchmarking means what exactly is like one hospital is following in this way, and my hospital is not having a complaints rate on this. So how we will benchmark or we will collaborate these two organizations together, and then we will take their point of views or point of or their practice, we will benchmark, we will discuss, and we will standardize to improve that complaints rate. This is like in a very brief form. How we can present the data. Very beautifully, we can present the data. Once you are going for the research and all the statistics and all, they will explain how the different diagrams that needs to be utilized and all. I think yeah, nowadays all the nursing students are more smarter, so they are currently they knows about that actually. So data visualization. Once we look on to the diagram, we will get a more idea about that. How my organization is running, how my nursing department is running. Then, as I told you, we can collaborate it with the other hospitals. I can present it, or for accreditation purpose, I can make it. I can present in front of the surveyors, survey for the survey purpose. I can identify the trend, how my hospital or my nursing department, nursing information system, or nursing care is growing. And this is the best example to tell the story about the data are the best example to tell the story. How? For example, as an informatician, when I joined an institution and after 2 years, the data from the institution that helps me to tell the story about my existence in that organization. This is how the beauty of the data. See, this is an example for you. Like I can show it to you how it's helpful. This is just an example. We are having a different kind of dashboards. This is what actually how we are visualizing our data. See, this is an example like we are having a multiple facilities. These are the different hospitals that we have it. And we are having some indicators. So it's like a patient indicators. Each hospitals in the centralized level, they can see how the complaints rate they are maintaining. This is an example. See, this is like a nursing dashboard actually that we are utilized in different hospitals. That how they are, and then that can be visualized. This is related to handoff communication. Handoff means once we are just sending, when we are giving a handover to the patient from one area to other, or from one nurse to other. This is how they are maintaining the compliance rate. This can be monitored. So once I entered my data, it can be visualized in like this in the centralized. So as an administrator, I can decide once I saw the chart is less. See, for example, this hospital, the complaints rate is high, but here there is one unit, the complaints rate is zero, or RDU, it's a dialysis unit, or it's a VIP. This is zero. So I, as an administrator, with one look, I got it. There is the three department. There is no data related to handoff communication. So what I will do as an administrator, I will go and identify the reason behind that. Even it's just because of a negligence, or because they have some restrictions on that time to enter the data, we will rectify based on this data. This is how the system help us, or guide us. So see, I can say like the complaints rate is, it's a hand hygiene. That's its 98.21% is they are maintaining. So what's my prediction? The next month also it can be same. It should be same or more. Once it's more or less, I need to think why it's shown less. So I need to go for the root cause analysis. This is how what exactly our data say. We are having this like a different kind of uh, dashboards that help a nurse to identify. And even don't think actually this is not just for the only for the data. Actually, even we are having like a step challenge. See how like we are having a step challenge in the hospitals. That's just for the nurses, or those healthcare persons' well-being. So how we are monitoring, how many steps you took, so that we can how they are working, how many months, so we can reward them. This is another way where how we need to motivate our nurses. This is how beautifully our system work. So here we will go for the conclusion. What we discussed today is nursing information system. That means what all are the main functions that happen in nursing information system. And also I explained the use of healthcare data in management of healthcare organization. Again, how to use information in healthcare management. What all are the four main components of nursing information system? How we evaluate, analyze, or present our data. And I present you a case study like how it needs to be visualized in an organization. Hope my presentation is clear. These are my reference. Now it's a time for discussion. Now it's a time for discussion. Yeah, it's a time for discussion. If you have any doubts or anything, you can just discuss with me. I think have everyone like looking ahead to work in the air roads or somewhere else, and also in India or in the government setups, you are already set your future plans. As a nurse, actually, yeah, having many plans actually. So this is how our nursing system, in technological wise, it's working, and it's very vast. So if you are having any doubts, you can just discuss. Yeah, good morning, good morning. I'm just still remembering how I'm just sitting and learning in the college. Actually, this is a great memory while I'm seeing you guys as are sitting and just looking on me. Actually, once many years back, actually, I'm also in the same place, and I just, but it's not through online. It's face to face. That's only the difference. But some classes right now, this is a great technology that's happened that we can just communicate each other, um, and can share the knowledge. Yeah, go ahead. You did you listen anything, or did you got anything from this class when you spend this much time? Sure. Uh, okay. Any doubts? Just let's discuss. We are already having a time actually. Mm, I have a lot of time, I believe. Any doubts? No doubts. That means you did not listen. If you don't have any doubts, that means you are not listening. The first person, those who are the one, I think she's the one controlling the mouse or what? Okay, so others can also talk, right? No, any doubts? Do wanted to know anything more about nursing, or how in my facility I'm working? Anything. It's not just related to the topic. If you want to know anything, you can just ask. If I know, I will tell you. You don't have that curiosity, or is it the first time? That's why. Uh, so we can wind up, right? Is it okay? I can just wind up the class. So you all know Dr. Chris, right? You know Dr. Chris, right? Yeah. So he's the one just I think introduced me. I'm just uh, like what I need to say. 1 minute. Yeah, I'm just wanted to utilize this time to say thank you, not for Shashibala. I hope I'm just pronouncing the right name. I hope it's a principal. Uh, so I just wanted to convey thanks to her, and also Dr. Chris. He's one of my great friend. Uh, and again, hope we can just meet somewhere. Uh, Better within this, you can just make a note actually, like an essay note actually, that contains 2 pages about this. That's that's what how you can keep the content. That may helps you for the exam. Can ask like in the short questions. Of course, you can just you can predict one question from health informatics or health information system as one essay or one short note. So you can just prepare for that in a basic way and basic form. This is what how the content needs to be covered. So thank you so much, each and everyone. Hope bless you for the better future. Try hard. When you learn hard, you will get a very great opportunity that's waiting for you. Sometimes it's might be difficult during the student's life and maybe you will feel something like heavy, but that's just for the 4 years. If you study hard, it's a very competitive area, so try to put your maximum effort, utilize that effort. Of course, you will gain much in the future. God bless you, everyone. We'll stay tuned. We'll see you again. Bye bye.